Well, there's two different types of plans. Actually, there's three different types of plans. There's Medicare supplements, which has been around for years and years and years. It's actually, when I first got involved in Medicare back in the late 1980s, early 1990s, Medicare supplements were the thing. Back then, they didn't have these Medicare Advantage plans. They didn't have prescription plans either. But a Medicare supplement, also known as Medigap, is a plan, it's a private insurance plan that picks up the gap or pays what Medicare doesn't pay. So Medicare has a deductible, Medicare has a deductible, the Medicare supplement or Medigap plan picks up the deductible. There's certain plans that pick up just about everything that Medicare doesn't pick up. So if a person will literally have no out-of-pocket when they go to the hospital and they go to the doctor. They're expensive, but they make sense in certain situations. If a person has a chronic illness or is receiving chemotherapy or infusion therapy or maybe kidney dialysis, these types of things are constant bills, that it might make sense to pay the premium for a Medigap or a Medicare supplement plan. Now, as years evolved, and the government came out with what they call Medicare Advantage plans. Now, that's the most popular thing in our area, in the Western New York area. In most metropolises, Medicare Advantages are very popular. What the government basically did is they didn't want to manage all the Medicare stuff. It was becoming a pain to them. So what they did is they pushed it off on insurance companies, which the insurance companies were happy to play ball because they make a lot of money on it. So what happens is the government gives the insurance, because a lot of these things have zero premium, or maybe $10 a month or $16 a month. So people always ask me, how does that insurance company make money? And when we're not paying them anything. Unlike a supplement or a Medigap, which I talked about before, where the people have to pay a premium, okay? So what happens is the government pays the insurance company for every client they have on their Medicare Advantage plan. A certain figure, it changes every year, but it's large. It's over $1,000 a month per person. So literally, let's just say it was $1,200, which the number changes all the time. What happens is, if you sign up with a Medicare Advantage plan with XYZ company, XYZ company picks up $1,200 a month on behalf of you every month, and that's just not money for profit though. They have to use that money, pool it with all the money from all the other clients they have to pay bills that are within the deductibles and whatnot. So once they get you on the plan, their hope is that they can keep you with them because they want to keep that money coming in. So how they do it is they play around with adjustments, like some have a $5 copay for a primary, some have a $10 copay, $30 specialist copay, $5 copay for this. So they play around with that to make it marketable. I mean, the new thing for 2020 was zero copay for primary. So everybody, what about that zero copay plan? Well, guess what? How many times a year do you go to your primary? Twice? So you save $20, you're all excited. But that's how the insurance companies do it. They market it to what people think is important. Now, because they get so much money, and if they're very good at managing their book of business, the insurance companies, they'll go to certain providers, they'll go to certain hospitals and offer them certain amounts of money. And so if they accept them, they're in network. And generally it's less than what they would like, the hospitals or the doctors, but they get the patients sent to them. One company says, this doctor's in network, they're going to go to that doctor because he's in network. You can't go to the other doctor unless you want to pay out of pocket. So it's all a marketing game on how they put it together. Now, they also add things like dental cleanings and x-rays. They add vision coverage, they add hearing aid coverage, free gym memberships, vaccines. One company for 2020 just started adding shots for shingles, which everybody's been complaining about for a number of years now. So they listen to what the public wants, and then they build it into their marketing plan to get you to sign up with their plan. Now, the interesting thing about Medicare Advantage plans is they change every year. So one company might come out with a really cool benefit that everybody wants, so everybody runs to that company, and then next year it's gone. Or one company might have a certain hospital. We use an example of Roswell Park here in Western New York. There's a lot of the Medicare Advantage companies that Roswell's not in network. Well, if people get cancer, they want to go to Roswell Park, right? So if the insurance company that they picked for their Advantage plan is not in network, well, they can still go to Roswell. They got to pay the whole bill.